Okay, okay, we're on.
Can you hear me?
Yes, Assemblyman, we can hear you. Thank you so much. So, hi folks, we're going to get started here in just about 30 seconds. Again, apologize for the delay, but we're going to be starting here in just a minute. Great. Well, thank you again, everyone, for joining. Welcome, and thanks for joining us for our second Grassroots Advocacy webinar, being hosted by the Cancer Policy Institute at the Cancer Support Community. My name is Rob Goldsmith, and I'm the Policy and Advocacy Director here at the Cancer Support Community. We're so happy that you all could join us today for our webinar on grassroots advocacy at the state level. This is the second in a series of webinars that we are hosting on a monthly basis. For those that aren't familiar with our organization, this slide gives a brief overview of CSC. CSC is an international patient advocacy nonprofit dedicated to providing support, education, and hope to those affected by cancer. Our organization includes over 170 locations across the country. These affiliates provide direct services, including social and emotional support, available free of charge to millions around the country impacted by cancer. We also have an extensive research arm with our Research and Training Institute in Philadelphia. Finally, there is our advocacy work being done through the Cancer Policy Institute. This includes our Grassroots Network and the webinar that you're participating in today. So this slide is a brief biography that covers my background. I was pleased to join the Cancer Support Community in February of this year. In my previous role, I served on the staff of former Congressman Bruce Braley as a senior legislative assistant. All participants are invited to ask questions at any point during the presentation. If you have a question, please type your question in the Q&A field at the bottom right-hand corner of your screen. It's now my privilege to turn it over to our presenter for tonight's webinar, Zena Carey. Zena has more than 2 decades of experience impacting public policy and leading advocacy efforts at the federal, state, and local levels. Zena has held various positions, including with the International Myeloma Foundation, the Leukemia and Lymphoma Society, and the National Health Council. She also served as a legislative analyst in the New York State Assembly. Zena will also be introducing our very special guest and keynote speaker for tonight's webinar. So without further ado, Zena, the floor is yours.
Thank you, Rob. It's really exciting to be with you all tonight, and it is my honor to introduce our keynote speaker this evening, Assemblyman Richard Gottfried. Assemblyman Gottfried is the chair of the New York State Assembly Committee on Health, and he represents the 75th Assembly District in Manhattan. He has chaired the Assembly Health Committee since 1987 and is a leading state health policy maker, not only in New York, but is also nationally known and recognized for his work. His highlights include, he has a very storied career, and his highlights of his legislative work include the passage of the Compassionate Care Act, laws that promote stronger primary and preventive care, and formation of accountable care organizations, creation, expansion of the Child Health Plus insurance program in New York, managed care reforms that strengthen the protections for patients and providers, the Healthcare Proxy Law, the Family Health Care Decision Act, and the HIV testing and confidentiality law. He has long sponsored the New York Health Act to create universal, publicly funded single-payer health coverage plan for New York. He works to protect and increase funding for Medicaid, school health clinics, HIV and AIDS services, as well as other health concerns. He's a leading advocate for patient autonomy and reproductive freedom. Assemblyman Gottfried is also a graduate of Cornell University and Columbia Law School and has served in the Assembly since he was first elected in 1970 at the age of 23. It's my honor to turn the mic over to Assemblyman Gottfried, but I also would like to say on a personal note, having worked for him as a legislative aide in Albany, I continue to admire and respect the work that he does for patients and families in New York. So without further ado, I introduce Assemblyman Gottfried.
Well, thank you very much, Zena, and it's good to be talking with all of you. I talk often about the subject of people concerned with health issues being involved in advocacy, lobbying, whatever you want to call it. It's a talk I give often to medical students and residents who are completing their training. I'm usually talking to folks who are going to be doing their work here in New York State, and so I will ordinarily spend a fair amount of time talking about the particular aspects of the structure of the New York State Legislature, which, while in some ways is like every other state. We have two houses, a larger house, a smaller house. We all serve on 2-year terms, et cetera. But the truth is, in a whole lot of things that really matter, no two states are really alike. Not only some have both houses controlled by one political party, some states it's a different party, some states have different parties in political control, some states the party in the majority in the legislative body very tightly controls what happens, and that is certainly true in New York State. There are other states where party control doesn't seem to matter much at all. There's one state where I'm told the Democrats and Republicans sit mixed among one another, which to me seems like an impossible way to go through life. But obviously they have figured out that you can be a legislator and sit next to people from the other political party. We just wouldn't do that in New York. But while all states are different in their legislatures, political makeup and the customs of the power of the legislative leadership, et cetera, in many ways, states are largely the same. How are they the same? Legislators get to be legislators because the people in their district elect them. In every state, the first requirement statutorily to be a member of the legislature is that you have to be a human being. And it's very easy to, assume that somehow your legislators are a different kind of being than other folks. And while we are, of course, all unique, your state legislators are human beings. They are ultimately people who, whatever you may think of them, to themselves at least like to think that it's important to them to do the right thing and to wake up in the morning and go to bed at night feeling at peace with what they have done or are about to do. And that's pretty crucial to the role of individual advocates who are not advocating for some commercial interest, but are advocating for policies that are important to each of you as patients, as family members, as care providers, whatever your role in this issue is. And, I don't want to try to kid people into thinking that our state legislatures are textbook paragons of democracy. Certainly people with money and power and influence have more power and influence in our legislatures than any civics textbook or public interest-minded person would want. But on the other hand, on an awful lot of the issues that you will be advocating about, legislators really do want to do the right thing. And no one should ever let themselves be sort of self-excluded from the process because you think that your voice won't matter. Never think that because you're coming to your state capital without a suitcase full of campaign cash, or because you think you are not a well-connected individual, never let that convince you to stay home and not join the trip to your capital or join the trip to your local legislator's community office to talk to him or her. I have seen countless issues over the years that are where victory is achieved not through the kinds of voices that are perceived often as being powerful and influential, but by the voices of ordinary individuals like yourselves. Certainly, almost all of our laws in New York and in other states providing for patient rights in dealing with managed care companies have come about through that kind of individual personal advocacy. Our smoking laws certainly did not come about because powerful commercial interests wanted to eliminate smoking in restaurants and other public places. They came about because advocacy groups and individuals talked to their legislators and convinced them. Wherever you may stand on the issue of medical use of marijuana, we, after many years of effort, got that law enacted in New York last year, as has been done in several other states. And I can tell you what got that legislation enacted, and I was the author of it, was overwhelmingly the fact that patients and family members, particularly parents of children with severe forms of epilepsy, were the voices that made that happen. And it was a long and difficult struggle, but ultimately it was the voices of patients and their families that made that legislation happen. And again, whether you like that legislation or not, the important lesson is the role that patients and family members played in getting it enacted. And so again, that's a critically important thing for each of you to remember. It's important to try to develop a relationship with your local legislator, your state representative, or whatever they're called in your state senator. I often tell medical students that the head of the American Academy of Pediatrics in New York State had the good sense to live down the block from me and always walked his dog in the morning, it seemed, at about the same time that I was heading to the subway. And also it didn't hurt that his daughter, who today is a pediatrician, babysat for my son. Now, obviously, he didn't arrange for all that to happen. It just kind of happened. But he took advantage of that, and whenever he needed to chew my ear off, he did. And even if you don't think you have any relationship with your local legislator, if you get involved in local political organizations, your house of worship may occasionally have events where your local legislator comes to speak, or your community association. There are all sorts of organizations that each of us belong to that can give you an opportunity to meet and get to know your local legislators, and that can be an extremely powerful way to magnify your voice and to make sure that when you need to speak to your state legislator, it's not the first time they're meeting you. But even if you can't develop that kind of relationship, working through organizations, as you all are obviously doing because you're on this call, is another way to magnify your opportunities to connect and to focus your message and to have that kind of opportunity to make your case. And I can't emphasize too often the importance. Never let yourself be deluded into thinking that you can't have an influence on your state legislator. I have just seen so many issues over the years where the voices of individual rank and file people from the neighborhood have persuaded legislators. And even if your legislator is not the Speaker of the House or the Majority Leader in the State Senate or the chair of a committee, ultimately, for a bill to become a law, it needs the votes of individual legislators. And ultimately, when committee chairs and legislative leaders hear from enough of their rank-and-file members of the legislature, they have to respond because that's who their constituents are. So your voice ultimately can matter and can make the difference. And for a lot of the issues that you are focused on, if your voice isn't there and the voices of people like you, it's certainly not going to happen. That's my pitch. I'd be happy to take questions.
Assemblyman, this is Rob Goldsmith again with the Cancer Support Community. Thank you again so much for taking the time to be on the call with us today and to share your insights. One question that we received is regarding just kind of there's a wide range of healthcare issues out there when you're talking about all 50 states all across the country. Mm-hmm. There's really so much going on, and I think it's probably fair to say that since New York is one of the larger states and one of the most populated states in the country, it has a tendency to kind of lead the pack in terms of trending issues, trending healthcare issues important to patients. What do you see as a trending patient access issue now? Are there any particular issues that you're looking at in New York that affecting patients that you think are going to be major issues across the country in the coming future?
Well, many issues are constant in various forms. I mentioned earlier managed care reforms. Insurance companies are always coming up with new ways to say no and to restrict access to medications or to the doctor or hospital that you think should be taking care of you. And those issues are constantly arising. I mean, every time we try to strengthen the law in an area, we often find that the insurance industry comes up with a new wrinkle to get around whatever we've enacted. So that is a constant effort. One issue that I am particularly focused on, which I would have to concede is at this point certainly not in the focal point of health policy in the country, is the question of creating a universal publicly funded health coverage system that would essentially replace insurance plans with a universal plan that would cover every New Yorker in the case of our state, rich and poor alike. I think that would make an enormous difference in terms of access to care and removal of financial barriers to care. We've passed that bill in the New York State Assembly. We're going to be spending the next couple of years working to try to get it passed in our state Senate. And I know there are people working on similar legislation around the country. Again, I don't want to kid anybody. That's obviously not, that's obviously a very uphill effort. I think legislation dealing with increasing smoking prevention programs are always a central issue, and people need to be on top of those issues in their state. It's always very important to be learning what other states are doing. And I've found over the years that, I always joke it's a good thing that in my line of work, plagiarism is encouraged. It's not punished. And some of the most important things that I think I've done in New York over the years are ideas that I picked up from what other states are doing. And so learning what's going on elsewhere is certainly important. One issue developing is the commercialization of the delivery of health care. The moving of more and more healthcare delivery into, for example, many of the major pharmacy chains are now having clinics in the store, which can be enormously convenient, but can also undermine the economic viability of your family doctor. And I don't know whether we want to live in a world down the road where you go to the doctor by going to some large chain healthcare provider, as opposed to going to an individual professional that you've come to know and trust. But I have a feeling that is may well be a development growing around the country. And I think we're all going to need to decide whether that's a road we want our state to go down or not.
Great. Well, thank you again, Assemblyman, so much for taking the time to be with us this evening and chat with us about your perspective and the importance of advocacy at the state level. We invite you. You're more than welcome to stay on the call and continue to listen to Zena's presentation on state-level advocacy. You're more than welcome to continue to be on the line with us. Otherwise, if you want to just go ahead and hang up, feel free to do that as well. So thank you again. We really appreciate it, and your words of advice are very encouraging to all of us.
Well, thank you very much. It's been terrific being with you, and I just hope everyone involved steps up their advocacy, because we really all depend on that.
Great.
Okay.
Thank
Good
you.
evening.
Yep.
Okay. Bye-bye.
Bye.
You. So thank you so much. Assemblyman Godfrey has dropped off the presentation, and we'll move to just kind of going through what you can expect from the rest of the program this evening. We're going to walk through each of the things on this slide. This is your presentation overview. We're going to walk through and try to give examples of each of these, as well as just a broad stroke of each topic. But we'll start with what is state-based advocacy, share your story, the policymaking process, how to develop a plan, meaning an advocacy plan, an action plan. What are some great examples, successful examples of state advocacy? What are some activities around advocacy activities that you can do to help push along your effort? Those include media, all types of media, earned media, social media. What are some resources that are at your fingertips to help you get started? And then how at the end of the day do you really start to take action? So what is state-based advocacy? Advocacy and activism defined. The act or process of supporting a cause or proposal. It's also a doctrine or practice that emphasizes direct, vigorous action. This is Webster's definition of advocacy and activism. Hopefully by the end of this presentation, we will have demonstrated kind of tangibles of what those two, of what advocacy and activism are. So what are the types of state-based advocacy? Starting with community advocacy. Community advocacy is a great example of community advocacy, and I'm sure all of you on the presentation tonight can relate to this, can think of your own examples. But, one kind of historical example is Love Canal, which was in 1978 in western New York. But it's, the residents of a local community can work together to advocate against, removing toxic substances from their community, whether it's in the air, water quality, but it puts the residents at danger. So that's just an example of community advocacy. But it's really, where a community comes together to work and press on an issue to make change. Healthcare advocacy really refers to either direct service of an individual or a family, but it also refers to the promotion of greater access to healthcare services like cancer care, which many of you on the webinar I'm sure are involved with. Then there's political advocacy, which is really about political campaigns. A great example of this is how do you get your issue how do you get it highlighted get your issue highlighted on the campaign trail? A lot of times, we can talk to candidates, go in and meet with the candidate to talk about an issue that is of concern to you, like increasing access to cancer clinical trials. Sit down with them, explain the issue, and see if they're willing to highlight that as they're out there talking to potential voters on the campaign trail. Research advocacy. A good example of this is becoming a member of the community advisory board of your closest comprehensive cancer care center. There are these positions available with comprehensive cancer care centers that they have different seats on those boards where patients, families, and others can apply to be a part of that advisory committee. And that's a great way to get involved on research advocacy. Then there's self-advocacy, and I think every single day we are forced to act as our own advocate in many ways. But as in the cancer community in particular, I think patients and their families are often, whether it's working with your provider on your care plan or advocating with the insurance company to make sure they're going to cover the treatment that your doctor is telling you is the best treatment for your care plan. So self-advocacy is just something we have to do all the time as cancer advocates, patients, and families. So what's the difference between state and federal advocacy? I think federal advocacy, and there will be another webinar as part of this series that goes over details of federal advocacy, but oftentimes issues that are taken up in the state legislature have more of a direct impact on our lives on a daily basis than what's focused on at the federal level. There are some key differences, and you can see from this graph, under federal, they're charged with passing bills that change policy on a range of national issues, including national defense, clinical trial oversight, and drug approval. They also recent history had a great impact on an issue that has been primarily, and it still is to a great degree, falls under the heading of state oversight, but the issue of health insurance, healthcare coverage in the form of the Affordable Care Act. They also set federal spending priorities for education, national defense, public health insurance programs, programs like Medicare and the Veterans Administration and others, and they do this along with the president. At the state level, they pass bills that change policy on a range of state issues, including health insurance, public schools, and division of motor vehicles, among others. The state legislature is also charged with, state policymakers are also charged with setting the state's budget and spending priorities for education, public health care programs like Medicaid, as well as the Affordable Care Act health insurance marketplaces, among others, and they do this in conjunction with the governor of that state. So who becomes an advocate? Many of you, if not all of you on this presentation, I'm sure are advocates, whether it's professional, as a family member, as a caregiver. But here's who typically becomes an advocate. Are you newly diagnosed or at another stage of cancer? Do you have a family member with cancer? Are you a caregiver? Or are you a provider or a social worker who wants to help their patients? I know from personal experience, I had been working as a professional healthcare advocate for many years when my father got cancer, and I suddenly found myself hoisted in the position of being his personal, I managed his health insurance benefits and coordinating with my family members, so I found myself in a much different role as an advocate, but it was a very personal role, and it was a different experience than doing it on the professional level. So what's the criteria to become a state-based advocate? I think we're all advocates. There is no special training at any level to be an advocate. I think one important thing to highlight is that small actions can make big changes. It's great if we can all get on the bus or get in a car and go to a lobby day that's being organized in our state capital city. But it's also it can be just as powerful to send a letter to your state legislator or write an email to them or make a phone call. There's just many ways that what seem like small actions can make a big difference in an effort to make change in health policy. You learn your issue, become an expert on your issue. It's really important to just for credibility and for advancing your cause, to really understand the ins and outs of the issue that you care about. And then I think one of the most important elements or criteria of being a state-based advocate is to have that passion and dedication. A lot of the issues that we work on, we all know, they're not easy. They're not easy issues, and many times they take years and years to make the change in the policy that's really going to help the patient or the family member. So it really requires passion, dedication, and I'd say, patience and tenacity. So one of the things I talk about in all elements of advocacy, whether it's state, federal, local, particularly when it comes to healthcare policy, is the critical importance of sharing your story. Why does sharing your story matter? It matters for many, many reasons. It puts a face on the issue for policymakers. It humanizes. It humanizes and personalizes the issue. It educates the policymaker and others about your disease, the problem, and the best solution. And at the end of the day, I've seen someone sharing their story make a huge difference. I've worked on many issues where, we came down to like the last couple of weeks, 6 weeks of a legislative session, and we thought yet again our bill was dead in the water. And, this was one year we had this happen in New York, and we had 6 weeks out, we found this young graduate student at Columbia University who had who had a really compelling story to share, and she was willing to share it with anyone who would listen. And so we got the New York Times, we got the Associated Press, we got the Wall Street Journal, we got all of these big outlets to cover it. And she did radio, she did TV, and we took her around the state capitol in building in Albany, and at the end of the day, it was her story that really turned the tide for us, and we managed to get the bill passed with only 6 weeks left and the governor to sign the bill into law. So sharing your story can really make or break any campaign. So how do you share your story? I think there are several important elements that need to be involved when sharing your story, but first of all, you need to make it personal. Just tell it from the heart. I think a lot of times we want to get bogged down in the details of the issue, when I think going and speaking with a state lawmaker about, this is personal to me, and here's how the current policy is having a really negative impact on me personally, and here's, if you make this change, this is how it's going to affect me personally. So make it personal. Describe how the issue has impacted you and your family, because, again, it's very personal. And for many folks, we're talking about access issues when it comes to health care, and so you need to make it, talk about, here's how this impacts me on a day-to-day basis. Be clear and concise about the change that is needed. And then this last graphic is my favorite, because one of the first things I learned when I got involved with healthcare advocacy, or advocacy in general, was a trainer who said, one of the most things change when an issue is urgent, local, and scary. And I say it all the time, but there's nothing more urgent, local, or scary than cancer. So share your story, and just make it personal and make it urgent, local, and scary. Tips for finding patient stories. Many times I've worked on many efforts to change policies around different healthcare services, and sometimes it can seem really overwhelming to find stories, but there are some kind of key things that you, if you're in the position of whether it's running, as part of a coalition or just starting up, working with like a small group of people, and you want to find the stories. This slide gives you some tips on how to, what are the things you need to think about to start with finding the stories. Figure out who you should target: patients, their families, and caregivers. Volunteers, and if you're part of an organization, look internally at, who are the fundraisers in your organization? Who's on the front lines with the patients in terms of patient services and advocacy and other programs? They may not even they're not thinking in the way that you might be thinking, but those folks are interacting with patients and their families all the time, and the stories are right there. Explain the issue in simple terms when you're talking to folks that you're trying to, help you find stories. And then there's some tips on how to reach patients and their families. Well, next we're going to move on to the policymaking process at the state level. There are 3 branches of government at the state level. There's the legislative branch, which Assemblyman Gottfried is a part of in New York. They are the ones that make the laws. They appropriate funds for laws and programs. They approve executive appointments, and they also establish the state court system. The executive branch, which at the state level is the governor, enforces the law, acts as negotiates. Well, they don't negotiate treaties, but they appoint federal or state judges and other top officials. And then there's the judicial, which they interpret the laws. They review the court decisions. They judge whether laws and executive actions are constitutional, and they rule on cases between states. Legislative, state legislature, the general facts. There are 2 chambers. There are 2 chambers in all state legislatures, with the exception of Nebraska, which only has 1 chamber. That's known as a unicameral legislature. But there are typically two chambers in state legislatures, and there's either they're either called the House of Representatives or the State Assembly. And then in every state, it's the state Senate. Depending on the state, they serve 2 to 4 year terms. And then depending on the state, again, they're part-time or full-time legislature. There are some states also that have where the legislators are term limited. Michigan is an example of a state that has term limits for their state legislatures. A lot of them don't, though. A lot of them aren't term limited. Specific powers of state legislatures: introduce and pass bills to change policy on a range of issues, including health care. They use the committee process to move legislation. Typically, in the case of healthcare policy, it's the two committees that you will typically deal with will be the Insurance Committee or the Health Committee in either chamber. And then they set state budget and spending priorities along with the governor. And this includes things like money for the state health departments, or the insurance department, which in the case of like the Affordable Care Act, there are the insurance marketplaces, which in most states is housed under the state health department. So the state legislature has to come up with some funding for programs like that. Process overview, legislative. Sometimes it can feel like a daunting task if you've never really experienced like working on a bill. Like, where do you start? There are some fundamentals. The first thing you want to think about is you have to find your bill sponsor and get the bill introduced. Understand the process. So once the bill is introduced, it then gets referred to a specific committee and goes to that committee where the committee takes action. And usually that's typically where, they'll like in Assemblyman Godfrey's committee, he has like hundreds of bills that go through his committee every year, every session, and some of them don't make it on an agenda for the committee to consider for a vote, yes or no, but many of them do, and so that's where the committee takes action. Sometimes they'll hold hearings on the bill. Sometimes they're just like on a fast track, and they just go to an agenda and they get voted on. It just depends. And then once it gets through all the necessary committee steps, it goes to the floor for a vote from all of the members. And if it passes, it then moves over to the other chamber, whether it's the Senate or the House of Representatives or Assembly. It starts that whole process over again. And then once it passes that second chamber, if you don't have bills that look like each other or mirror each other, most of the times, again, depending on the state, it'll go to what they call a conference committee, where they'll have members from either, like a select few members from each chamber to come together to decide what's the final version of this bill going to look like. And then it goes into final passage. Once it goes through final passage, and this is kind of a recap of the last slide, but it's once you get a bill passed, it goes to the governor for a veto or a no. So what are some ways that you can identify your bill sponsor? I think it's important to, one of the kind of like politically and strategically you want to think about is, go to the chair of the committee. Once you know the bill's going to be referred to if you think it's going to go to health or insurance, you want to go to start with the chair of that committee. So in the case of Assemblyman Godfrey, let's say you have a bill where you want to try and soften the effects of certain policies around access to like treatments. So go to Assemblyman Godfrey and say, we have this issue, we have this bill, would you be willing to introduce it? Because he is in a position, because it'll go through his committee, he's just in a position to like kind of fast track things a little bit, being chair of that committee, and to bring members of his committee along, as well as leadership in his chamber. There is a resource link at the end of this presentation that we'll talk about in a minute, at the end of the presentation, where it gives you more information on how to get started with that process in your state. You also want to think about like members who might have a connection to cancer, because they're going to understand your story right away because they personally are dealing with it themselves. You can also discuss this with your partners that you're working with, partner groups and others. Another really important thing that makes it easier to get your bill introduced is to have, sample bill language, a summary fact sheet, available statistics, and any other key background information that's going to help educate your bill champion on the issue. As Assemblyman Gottfried said, a lot of times they're very busy. It makes it easy if you can go to them with a packet of information and say, here, and sit down with them and say, here's my issue, here's all the background information you need. I can get you more if you need it, but this will get you started. It just makes it easier for them and more likely that they'll be willing to champion your issue. Where do you start in terms of whether it's the House or Assembly or the Senate? It really depends on your state. Some states will make you start with the lower chamber and then move to the Senate. In some states, it doesn't matter. In New York, it doesn't matter. But that's one of those things that you will figure out. You would have to figure out with using the resource links at the end of the presentation was the best place to start. The committee process, as I said, it really varies from state to state. Sometimes there's a subcommittee that where they'll hold. Again, it's a state-to-state thing. Usually in committee, unless it's just a perfect bill and you can get every member of the committee to agree, changes are often made to the bill. Floor action, it goes. A lot of times there's debate on the floor. Changes can be offered on the floor as well. And then members vote on the bill. Final action? Yes.
Gina, this is Rob. One quick point I think I'd just like to make here, if that's all right. I think it's it's understandable. You look at all of the different procedures and things that happen within legislatures. It can get a little bit overwhelming, I think, at times. When you see all the different things the different maneuvers and procedures that have to be done. I think, the most important thing to keep in mind here is that, whichever, and I think the Assemblyman kind of addressed this as well, whichever political party is in control of the said chamber is going to be able to use all of these procedures and rules to move pieces of legislation that they want to see moved. And I think that, as an advocate, the reason it's important to know that if you have an issue that you can bring to the table and make, whomever you're meeting with recognize that this is an important issue and should move, they're going to figure out how to use all these different rules and procedures to move the legislation that you want to get moved to the floor and ultimately to the governor's desk.
Yes, I think that's right, and that's great advice, Rob. And all of this is all general overview of how the whole process worked. But one of the things that I guess one of the major points I want to stress is that the legislative process, and this applies to the state legislative process as well as in Washington, I've always referred to it as a sausage-making factory. It's a messy, messy process. And there are steps that there are fundamental structural steps you can take to get things started, but then you always have to build in room for something could and probably will go wrong, quote unquote. But then it becomes a challenge. It then becomes a matter of how do you take when things go wrong? How do you make lemonade out of lemons? Because there is no yes, there's like a structural steps you can take, but it's a messy process, and it's just again it can take years to get bills passed. Sometimes I've had bills introduced and passed in 1 year. Most of the time on the issues we care about, it takes at least 2 cycles, 3 cycles to get something through, but it's always a messy process no matter what. There are some other ways in terms of the process to make change outside of the legislature. Another one is the regulatory process. So what is the regulatory process? Regulations are issued by state agencies, and they're carried out to modify existing programs authorized by the governor. It really applies to your state agencies like your departments of insurance, health, environmental conservation, DMV, among others. Regulatory changes have the same force of law, meaning, it has the same, it holds as much weight as if you were to get it passed through the legislature and become law. And all state agencies may issue, they can come up with their own proposed regulations. And they do this. They also have to issue regulations around new laws that have been passed by the legislature. But they can issue regulations outside of laws that are passed by the legislature. And they also clarify and interpret laws that have just been passed. and they also implement new priorities. Another process, which is, this varies. It's wildly ballot proposals, initiatives, and referendum, also referred to as INR. There are more. These are it's all over the map in terms of how each state handles ballot initiatives and referendum. In some states, it's extremely popular, and we always hear about California. I think California is a great example of a state where ballot initiatives are really popular, and the legislature can do something, and if the people don't like it, they can come behind the legislature and introduce a question on the ballot to overturn what was just done. So it's California. We hear about it all the time in the national news, but it really just it varies from state to state, and it's a lot of the same elements, like steps that you would use in a legislative campaign. You would use in these types of efforts, but it's a whole other ball of wax as well. And again, it's not the most. It's just not the one that's mostly used to make change on health policy. Some more info, and then if you want more information, there's a link there about INR or ballot initiatives in your state. There's a link for the INR Institute. So let's talk about the executive branch or the governor's role in each state. The powers vary from state to state. Texas is very different. The power of the governor in Texas is very different than, say, Andrew Cuomo, the governor of New York. But the powers are set by the state constitution, legislature, and the tradition of that particular state. It's a 4-year term in most states, commonwealths, and territory. New Hampshire and Vermont are exceptions where they have 4-year terms. They change policy, and some states have term limits where their governors can only serve a certain number of terms. And what do? They change policy. They can change policy through executive orders, legislation, and the regulatory process. Here's some more about their specific powers. They set state budgets and spending priorities along with the legislature. They can enact or veto bills, and they confirm executive and judicial appointments. They are at the center of power when it comes to natural disasters and catastrophes like 9/11. They also they oversee state agencies like departments of insurance and health. And a lot of times the policies of those state agencies will reflect whomever is governor at the time. This next slide, this is sample state legislation, just to give you a kind of a peek at what a bill looks like. Most of you have probably seen bills. This just gives you a peek at sample legislation. The next branch of government, judicial, which is the court system. They are charged with interpreting state laws and protecting individual rights as granted by the state constitution. They also act as a check and balance for the legislative and executive branches. And they are there to hear civil and criminal cases and settle legal disputes. So what do things look like around the country in terms of state legislatures' party control in 2015? Back in 2010, I always call them waves, but in 2010 was the last time there was a kind of a wave of takeover in terms of state legislatures, and it went to, as you can see, this map is pretty much a wash in a sea of red. So back in 2010, the Republicans swept many, many state legislatures. And this happens periodically where we see it, and we see it at the federal level too, but it happens periodically where we see, one party will just, they do great organizing, they have a lot of money to spend, and they go out and they just very methodically build campaigns to take over these state legislatures in as many states as possible. So 2010 was the most recent, and I think a good example of where we've seen that happen federally was back in 1994 when Newt Gingrich took over. The Gingrich Revolution swept Congress. But again, we've seen it happen. We've seen Democrats do this. We've seen Republicans do this. And right now, what we have right now, as I said, is a product of 2010, the 2010 sweep. What's going to happen 2016? I think it's really, really hard to predict just yet. It's still fairly early. I do think that we'll see the fact that there's a presidential election in 2016. I think that's going to make that. What tends to happen is there's a bigger turnout during presidential elections, and so we'll see some trickle down, and we'll see that have an impact on what if things change at the state level. Will that have an impact? But again, I think it's just too soon to predict how things might play out in 2016 at the state legislative level. But I think we should all stay tuned because I think it's going to be exciting and fun. If you have any questions, please be sure to put them in the Q&A field on at the bottom right, and we would love to answer as many questions as possible. So how do we develop a plan? Well, the first thing you need to start with is you have to identify the problem. You have to research the issue and determine the solution. But to give you a better example, what we thought we would do is, how do you get started with those three elements? I think the first step is to, have it pull together. If you have an issue that you're interested in, or one that's, particularly like let's say you're in a support group, and you know from personal experience, and you're talking to others in your group, that you're all having the same issue with accessing, a particular your treatments, and it's because your insurance companies are all utilizing this one policy that's keeping you from being able to access that treatment. You pull those folks together. You've identified your problem, and the next thing you want to do is just do some research and dig in and figure out, dig up the background that you need on it, and that will help you kind of come to the solution. Well, what could be the best solution to this problem? And then you walk through the steps of, we talked before, how do you find your potential, issue champion, and then develop. We're going to go into tactics here in a few minutes that will go into kind of overall plan of what tactics to put in place to get your bill passed, including which events to hold, what kind of media attention do you want? How do you find the patient stories? How do you integrate them into your effort? But the next slide is really, the next couple of slides is really about how do you go through and do an assessment to figure out if an issue is really an issue. In this case, I'm using an example of an issue that I worked on many years ago. Is at the state level, but it was in a bunch of states, but it was at the national level. And what we found was that for clinical trials, we had many patients that were unable to get into a cancer clinical trial that their physician was recommending for them. And what we found was the main barrier was lack of insurance companies' willingness to pay for the routine care cost in a cancer clinical trial. And so we took a look at that issue and said, well, this is an insurance issue, and at the time, and it still is primarily, but insurance is primarily regulated by the state, and so it became a state issue. So the first thing we had to do was to figure out, well, what is routine patient care? It includes, many of you know, it includes hospitalization, diagnostics, and supportive care medications. And we had to explain why clinical trials were important. They're important because potential medical breakthroughs are put to the test, and many patients want to participate because it's good for the breakthrough process. But it's also for many patients, it could be the treatment that they need could be in that trial. It could be the thing that saves their life. The sample issue assessment too. We had to show how does lack of insurance impact the patient. Patients were unable to enter the clinical trial because of the financial barrier. If the company wasn't willing, if the insurance company wasn't willing to pay for the routine care, the cost of those services was overwhelming for most people. They didn't have several $1,000s laying around to pay for them out of pocket, and so the patient would just not be able to go into the trial because of the financial barrier. Many times, and we'd heard this, if a clinical trial doesn't, we know that if a clinical trial doesn't have enough participants, it can't get off the ground, and so there's disbandment of trial, which means potentially a new treatment is not found because the trial couldn't move forward. The next thing you want to be able to show is, how does changing this policy, how will it protect patients? How do you protect patients? You find a lawmaker that's willing to, introduce the bill that you've come up with, change the policy. In this case, we went into, a state where they did not have a law that required insurance companies to cover the cost of routine care. We found champions, and we got them to introduce a bill that would change that policy. And we launched full-blown, campaigns or efforts to support the bill in those states. We partner with, the cancer support community would partner with groups like American Cancer Society and others to support the passage of bills in multiple states. The effort included, lots of activities, including lobby days, placement of opinion editorials, letters to the editors, patients sharing their stories in a variety of ways, including on TV, in radio interviews, in a patient profile piece that's written up on the Sunday paper, which we did many times and was fantastic. It really helped us get a lot of traction. So how do you get started with all of this? This next slide gives you some key websites to start your research. Many of you've got the National Cancer Institute, NCI, Centers for Medicare and Medicaid Services, the Food and Drug Administration, and then the National Comprehensive Cancer Control Program, which is a program out of the Centers for Disease Control. These programs exist in every state and can oftentimes be a very helpful entity to work with if you've identified an issue that you want to make a priority in the cancer community in your state. This next slide is an agenda. It's just a sample agenda, things to think about for your first meeting that you would do. You pull together your small group, and your first meeting is to lay out, talk about the issue, identify what's the problem, talk about the solution, what are the next steps, and also just to develop your plan or your campaign. But these are all the elements you should think about covering for that first meeting. This next slide, again, is just some tips to think about when planning your meeting. And one of the things I didn't put on here, but I think is always really crucial, is kind of the field of dreams idea. But in this case, if you feed them, they will come. It oftentimes helps to organize a meeting around a meal. So whether it's a breakfast meeting or a lunch meeting, and there's food involved, a lot of times that it is an incentive to bring people to the meeting. The issue always is as well, but I think it kind of personalizes it and makes it just a meeting that's where people are comfortable talking about the issue. So the next slide is to talk about some key examples of successful examples of state advocacy. I briefly talked before about the legislative efforts to increase access to cancer clinical trials. And as I said, this was an issue that I worked on several years ago, where we found that thousands of patients were being unable to enter a cancer clinical trial because their insurance company would not cover the cost of routine patient care. And of course, routine patient care includes hospitalization and supportive care medications, among other services. Why did it matter? It mattered because clinical trials often offer the best chance of finding the best treatments and advancing care. And at the end of the day, for many patients, they find the treatment that saves their life or extends their life greatly. The solution, the national effort to tackle in the states, it began in 2007. When we first entered into the issue, there were 19 states that had laws requiring coverage of routine care in cancer clinical trials. By 2010, we had increased that number to 33 states in the District of Columbia. And we had enough momentum. They were in the process of negotiating the Affordable Care Act. And we had enough momentum so that our our federal team could go to the administration and talk to them about, you know, you're doing this package of insurance reforms. 33 states and D.C. have done this. Why don't we make this uniform? And so we got a provision in the Affordable Care Act that said that by 2014, if a state had not passed its own individual law to cover that, require insurance companies to cover routine care costs, that they would have to follow a federal provision that did require it. So it was a great example of how you can, with enough, using a state strategy around it, you can help build momentum to get something passed at the federal level and do good for all across the board. Again, working with groups like the American Cancer Society, American Society of Clinical Oncology, Leukemia and Lymphoma Society, Cancer Support Community. It's really these broad-based, groups of people that help make these efforts successful, regardless of what the issue is. And it included activities like lobby days, earned media coverage, and always the sharing of personal stories. And this last slide is just to give you kind of a visual snapshot of 33 states, D.C., and the federal standard for coverage of routine patient care in cancer clinical trials. At this point, I'm going to turn it over to Rob Goldsmith to go over the second example.
Thanks, Zena. I appreciate it. So I want to talk just real quickly about a state-level issue that the cancer support community has been pretty involved with here the last couple of months. So a couple of months ago, we heard about a situation in Iowa that was directly impacting patients' access to treatment. Essentially, this commission called the Iowa Drug Utilization Commission, which is essentially a board that falls within the executive branch of Iowa's state-level government. This commission recommended something called prior authorization restriction for certain oncology medications. And what prior reauthorization is it requires a pharmacist to get approval from the insurer before filling the prescription, the specific prescription. At CSC, we believe that this is actually violating existing Iowa state law, which protects certain classes of medication from prior authorization. So you might be looking at this information and asking the question, why does this matter, or what does it have to do with patients? And the answer is that it does matter because this prior authorization requirement will likely delay a patient's access to treatment. Prior authorization creates a barrier or a hurdle to life-saving treatment for Iowa's most vulnerable cancer patients. Also, it's important to note that these are patients that generally struggle with more severe and life-threatening health issues. So after we heard about this issue, last month what we did is the cancer support community sent a letter to the commission in Iowa urging them to reconsider this proposal. We received a response from the commission stating that they had no plans to change the policy. And then right after we got the letter back from them, the commission met on August 5th and essentially said the same thing that they told us in their letter, that they weren't going to change the policy. However, since this meeting has happened, we've heard that the policy is actually under review and could still potentially be changed. So there is still time, we think, to reverse this misguided proposal. So again, we at CSC believe that this proposal needs to be reversed in order to protect Iowa's most vulnerable cancer patients and to ensure them access to cancer treatments. We also think that what's happening in Iowa could potentially happen in other states as well. We believe this policy could spread to other states across the country, and we think that this essentially might be the beginning of something that could affect other larger states and different regions of the U.S. So what we're going to be doing very soon is we're going to be activating our grassroots network and we're going to be asking all of our members, asking you to weigh in on this really, really important issue. And Zine, I know that you have some familiarity with this too, so I don't know if you have anything you'd like to add from what I've just kind of gone over here.
I mean, the only thing I think that's a great overview, and the only thing I would add is that this is also a big senior issue because a lot of seniors are on Medicaid because if they're dual eligible, meaning that their income is low enough that they qualify for both Medicare and Medicaid. And so those folks, they don't get their drugs through the Medicare Part D program, they actually get their drugs through the Medicaid program, their state Medicaid program. And so this could be a huge issue. And, with cancer, a lot of there tend to be higher rates of cancer in seniors. And so we see this as a very much it's a senior issue as well. It's, for poor seniors or low-income seniors who rely on the Medicaid program to get their drugs, the necessary treatments. So next we'll move to advocacy activities. All of these, the next many slides are really designed to help you. Now that we've talked about how do you identify the problem, the solution, and ways to find your bill sponsors. What's a general overview of the process? What are some activities? What are some tactics you can use? How do you put together the plan? And what are some tactics you can use to help push along your issue? And so these next many slides are just some ideas of things that you can do. And again, all of these would be, you do them in the context of timing is everything. What's the right time to do a lobby day? What's the right time to do this type of media strategy? But this is just the general overview of the types of activities you can conduct in an effort to change a policy in your state. So generally, tactics to target state policymakers: emails, letters, postcards, phone calls, patient stories, district visits, but also any sort of legislative visit. Sit down with your legislator or legislators. Town hall meetings, issue forums, public testimony, lobby days, and build partnerships. Sample emails to state policymakers. This is an example of an email that I actually sent to Assemblyman Godfrey's, one of his staff people this spring, we were working with Assemblyman Godfrey on an issue on a bill in New York. And so this is to his staff person. This is a little bit of a different, more personal communication with a staff-to-staff person, but many of you, if you really do launch into trying to get a bill passed, one of the things you will do is develop relationships with staff members of the state legislators that you're working with, where you would have these type of very personal communications with them. There's also the type of email you would send as part of an action alert, where it's just more of a general email to legislators. There's sample letters to lawmakers. Letters make a difference. Again, we talked early on about how not every tactic has to be a lobby day or something big and grand. A simple letter sometimes can make all the difference in the world, especially if it's a letter that you're sharing your story and personalizing that issue to the lawmaker. So this is just a sample letter to a lawmaker. Postcards. I've been involved with many campaigns that used postcard campaigns. We've used them we had one called the Postcards for Parity around access to oral cancer treatments. Very successful. Another one was many years ago around education that I used, where we collected thousands of postcards from college students from around New York State, and we culminated around the holidays, where I was dressed as Santa Claus, and we delivered the bag of postcards to Governor Mario Cuomo in the Capitol, and I actually got to shake hands with the governor. So postcards can be really powerful, especially if you do them in high volume, and you at the end of it you have some sort of fun event around them, to highlight the volume of postcards that you've generated, but it can be a really powerful communication tool. What are some key tips? I think there's some key written communication tips for regardless of whether it's an email, a letter, a letter to legislator, or a postcard. There's just some kind of rules to follow, and this is at the state or federal level. But you want to be very clear and concise and state why are you sending them a letter or an email. Put that right up front. I'm writing you to ask you to support my bill, HR or SB 1331, and then give a brief sentence of what that bill does. This bill to require insurance companies to cover the cost of routine care. You always want to, and then the rest of it's kind of standard. You want to be courteous and polite and professional. Be sure to let them know who you are. If you're a constituent, you want them to know that. So give them your name, your home mailing address, and other contact information in case they'd like to follow up with you. The next tactic you can use is phone calls. Phone calls can make a huge difference, whether it's just you picking up the phone to call your legislator, or call the office and tell them that you support a specific bill, or let them know that you've got this problem around an issue and see if they can help you sort it out. But phone calls can also be used just like the postcard campaign. You can do phone call campaigns. There's lots of creative things you can do around phone calls. And this is just kind of a standard script to follow, just general rules and kind of to follow when making phone calls to offices of state policymakers. More tips these are some tips to follow. The next is, conducting visits with state policymakers. These are tips that apply, whether it's a sit down in their district office or you run into them at one of their Saturday coffee clatches. A lot of state legislators do that, where they'll say they're going to be in this coffee shop on this Saturday, and you're going to sit down with them. These are just some rules to follow, regardless of what the setting is. But if you're scheduling, if you're going for a scheduled visit, you always want to give yourself some time in advance. Call the office and set up the meeting, and then follow up to confirm with an email. And always make sure you follow up, prior to make sure the meeting is still on. These are just some general tips to when you're conducting those meetings. And you'll see at the end, share your story. That, as you can see, that is a theme throughout everything we're talking about tonight. But sharing your story is always essential. Some more tips. Organize a town hall meeting. Town halls are there. It's just another type of event you can hold. A lot of times we associate town halls with political campaigns, but you can also use the town hall setting when you're trying to highlight a specific issue. Conduct an issue forum. Issue forums are a great venue as well. It's a little bit of a different setting than a town hall meeting, in that you would have a panel of like experts that are going to highlight like 2 or 3 tops to focus on different aspects of the issue, and then you follow it up with a Q&A session at the end. These are some tips whether you're organizing a town hall meeting or an issue forum. Good things to follow. Some more tips. The next event that you could potentially do is hold a lobby day, and these are grander in scale. They don't have to be 300 people at the Capitol, storming the Capitol. Depending on your state, a successful lobby day can have 25 or 30 people. I spent 4 years. I spent one of my states that I did a lot of work in was Iowa, and the lobbying environment there is much different than like New York or California. It's just smaller and more intimate. And so we did a quote unquote lobby day every year. We'd have 30 to 40 people coming, and that made a huge difference in Iowa. Because they weren't used to that, and the process of speaking with legislators, they didn't have offices, so we'd have to pull them off the floor and talk to them behind the chamber. But lobby days can be a really like kind of one-stop shopping if you have the resources and time to pull something like that off. They can be a really effective tactic to pull out, to pull out of your bag of tricks in your effort to get a bill passed. These are just some more information about lobby days. A checklist on things to think about if you decide you want to hold a lobby day. Some more tips. Another tactic that you can use, and we briefly talked about, giving about public hearings around bills in committees. So this is a snapshot of a testimony I gave on an issue a couple of years ago, where it's like public testimony. And so if a committee is, let's say Assemblyman Gottfried is having a hearing on your bill, and he's inviting different people to come in and testify at the hearing, this is the type of testimony you would want to give. It would be specific to your issue, but you'd want to put something in writing, and then you submit that to the clerk at the hearing for the record. But you also kind of touch on the highlights of your testimony. But it's another way to inject your position and opinion on any given issue that you're working on. Here's some tips for giving public testimony. A few more tips. The next thing that's really important, I think, in any of this, one person can make a huge difference in an issue, for sure. But a lot of times, if you can build partnerships with other organizations or other individuals, there's strength in numbers. We've all heard that phrase, and it's true. So anytime you can build partnerships with folks or organizations, it can really strengthen your effort to change the policy around the issue that you're working on. And so these are just some tips and some ways to build partnerships. The next kind of phase of activities, range of activities you can do is the media. Media is critical in every effort that we do. It's kind of like if a tree falls in the woods, nobody's around to hear it. Did it make a sound? I think you always want to. Not for your coalition meeting or your partnership meetings do you want to invite the media, but anytime you're trying to generate interest around an issue, whether it's through a lobby day, meetings with legislators, just getting the media to cover your issue can make all the difference in the world. It's like opening the door and letting the sun shine in. So some of the ways that you can have an impact in the media is you can do letters to the editor, you can do opinion editorials, you can hold news conferences, you can do radio and TV interviews, which oftentimes will come from the news conference that you do, but you can also do those just separately. You can talk to reporters to do a featured profile story on your issue. And then there's also, nowadays, social media is really is a big part of any sort of effort to change a policy. So Twitter and Facebook, and I'm starting to see some folks some groups starting to use Instagram in a really creative way, which I think there's a lot of fun possibilities there with Instagram. So here's a sample letter to the editor on another issue that I worked on years ago. Tips for drafting a letter to the editor. And I think, again, all of these are, generally speaking, these are tips to use in any sort of written communication. But there are some standards to follow when you're doing letters to the editor or an opinion editorial. This next is an opinion editorial. And many people sometimes want to know what's the difference between an opinion editorial and a letter to the editor. Well, a letter to the editor is shorter, and it's, a lot of times a letter to the editor could be in response to an opinion editorial. But an opinion editorial also just it's a longer medium and gives you more chance to really lay out your issue. Both the letter to the editor and opinion editorials are found on your paper's editorial page, and you can find out their policy by going to the editorial page of your paper or the website. Here's some tips on how to draft an opinion editorial. You always want to humanize the piece, tell your story. I know I sound like a broken record, but in any of these, whether it's any of these tactics, telling your story is so key. Some additional tips on drafting an opinion editorial. Here's a sample news release, and you typically do a news release if you're holding a news conference. You can also use a news release to announce, to get coverage for your town hall meeting, your lobby day, your issue forum. But the news release is something that's used. You can also just put out a news release like to the press about your issue, but a lot of times you use them in conjunction with an event that you're holding. And I've seen reporters where I just gave them a release, and they write the story from the release. And so it's a really good way to also control this, what the story looks like that the reporter is going to write about. They get the issue right, they get the message right. It's just across the board. It's a good way to make sure they get the story correct. Here's some tips for organizing a news conference. News conferences, you can use them in lots of strategic ways, whether you're launching your campaign, you pull together your partners, find a room at the Capitol and have the news conference, or if you're having a lobby day, you can do a news conference in the morning before your lobby day where you've got a panel of experts and your bill sponsors speaking. But the news conference can be a really effective event to hold to get reporters all in one room and get them to cover your issue and write good stories about it on one day, kind of a blitz. Tips on giving radio and TV interviews. And then social media. Social media keeps gaining power over how people think and get the news. The cancer support community does a tremendous job with social media. And here's some examples of things that they've done on Facebook and Twitter, and some tips for using social media. I think there's graphics and pictures are always. With social media, less text, more graphics that kind of speak to the issue or the message you're trying to get across. But there's some standard rules I follow. Is it true? Is it important? And will it make a difference to the issue I care about? I think those are some key things to think about. Now we move to resources. Some key websites in addition to the ones we spoke about earlier in the presentation. But if you want to learn more about, a good place to go for more information about your state legislature is to go to the National Conference of State Legislatures. It's just a huge resource for information about all 50 state legislatures, as well as issues that are pending in those states and kind of those issues that are trending around the country on healthcare and other issues. The Sunlight Foundation's Open States Project, that gets more into the politics of your state. And then, of course, one of your greatest resources is the cancer support community. These next three slides, if you're interested in finding out, you're going directly to your state's state legislative website. These next three slides give direct links to websites in your state that will tell you about your House of Representatives or Assembly, your state Senate, your governor. There's bill tracking. There's just that link will take you to everything you want to know about your state legislature and executive branch and other aspects of your state government. And then finally, almost finally, really another great place to start for taking action on getting involved with state issues is to contact Rob Goldsmith, the Director of Policy and Advocacy for the Cancer Support Community. Again, we'll field questions before we close for the night. And then we'd also like to thank our sponsors who made this educational webinar possible with grants from Bristol Myers Squibb and Novartis. And with that, I want to thank you all for your time tonight, and I'll turn it back over to Rob Goldsmith.
Thank you so much, Zena. Really great, informative information. I think that's going to help everyone. Good education for all of us, I think, in learning how the whole process works at the state level and how to get more involved as an advocate at the state level. So I think in the interest of time, we're going to just go ahead and close up the call now. However, if you do have any questions, please feel free to email me. I'm more than able and willing to get back to you if you have any follow-up questions from anything that we've talked about today. Also, just wanted to make sure you all are aware that we will be sending out the slide presentation. We'll be sending it out to everybody that was on the call, so you'll be able to go back and look through it. If there's anything you want to review on your own, you'll be able to do that. So look for that email in the coming days. Also, keep an eye on your email for our next webinar, which will be on advocacy at the federal level. We'll be announcing the date for that soon, so keep an eye on your email for that. Again, as Dina mentioned, want to thank the sponsors of our Grassroots Advocacy webinar series, Bristol-Myers Squibb and Novartis. So thank you all very much. We appreciate you taking the time to be on, and we'll talk to you all soon. Have a good night.